IMET 2000 and Horona Hospital are working together to help improve eye health in Uganda. Using our ambulance, we target villages with a high population but limited health facilities. As well as doing free eye checkups, free HIV, malaria, blood pressure and diabetic checks are also carried out. These are just 3 of the sites we visited. In Katosi, we saw 222 eye patients. We gave out 112 free reading glasses. We saw 18 patients with cataracts and 110 patients had other eye conditions which they were given free treatment for. In Seta Nzigo, we saw 281 eye patients. We gave out 122 free reading glasses. 94 patients had other eye conditions which were treated and 24 people had cataracts. In Namienji, we saw 358 patients. 251 of those were eye patients. We gave out 128 free reading glasses. 89 patients were treated for other eye issues and 13 patients were found to have cataracts. Once we've identified these patients, it's important that we give them help. IMET 2000 are funding free cataract operations at Horona Hospital, and the patients are given the opportunity for this free surgery. Twice a month, Dr. Susan Chichira, a consultant ophthalmologist, and her team come to Horona Hospital Chisoga and do 20 cataract operations each visit. Lydia, an ophthalmic clinical officer, heads our eye department at Horona Hospital and is responsible for booking patients for cataract surgery. Lydia does detailed eye examinations and nurses take the patient's vital signs including blood pressure, pulse, temperature, oxygen and blood sugar levels. Patients start arriving on Friday morning. Lydia and the nurses again check each patient ready for their operations and they're given a bed. Saturday, and it's the day of the operation, and the patients are up early and are each given pre-operative care by Lydia and other nurses at Horona Hospital. Dr. Susan and her team arrive and set up their equipment and begin work. So far, they have successfully completed over 600 surgeries in this free IMET 2000 program. After, patients are admitted on ward and given post-operative care with continuous pain monitoring. Sunday morning starts with detailed health education of how to take care of your eye once you are home. All the patients are examined and visual acuity is taken again. 2 weeks later, and Lydia has the patients back for review and gives further treatment when necessary. And those patients with bilateral cataracts are booked in for further surgery and various medications are prescribed depending on the outcome of the surgery. Charles was screened for cataracts at our Katosi outreach. He came to Horona Hospital led by his wife. Charles has been blind for 4 years. Charles has never seen his 3 youngest children. Right now, the 2 eldest children have finished P7 and P5. They cannot afford their school fees anymore, so the children are out collecting plastic bottles to help pay for food. The youngest children are in school. We worked on one eye, and Charles's second eye has been booked in for surgery. He came back for review, moving around freely on his own. He told us he still can't believe he will remain with his vision. He told us how his wife had been husband and wife for the family, and for the first time he had seen his wife's affected ear and realised how much she had been through. As well as helping Charles with surgery for his other eye, we are also trying to help his wife. Mike came with his sister to our Seta Nzigo outreach. Both brother and sister have been blind for a long time. They could not afford medical assistance, so when they heard about our free outreach, they used the chance to get treatment. On examination, we discovered that Mike could be helped through surgery, but unfortunately his sister has a congenital eye problem for which we could not find any solution except to counsel the patient. However, Mike came to Horona Hospital for surgery. Though after surgery we found complications at the back of his eye, his vision improved, but at his 2-week review Lydia found that he would benefit significantly from glasses. Mike will be having his other eye worked on and after 4 weeks been given glasses, and we are confident that he will be able to return to school. Going to these more remote villages and giving free eye examination and treatment helps ensure early identification of eye disease, making their management easier. Diabetes is tested and treated and can be a precursor to eye diseases including diabetic retinopathy, cataracts and glaucoma, which leads to irreversible blindness. Mature cataracts are commonly found on our outreaches, and having free cataract surgery means these patients have the opportunity of getting their sight back, something they could never afford to do alone. These two programs work hand in hand. Please help us continue with outreaches that help so many people, and also with cataract operations, giving people back their sight.